Hey everybody, talking a little bit more about non-surgical treatment for subungual exostosis today. Really, there's some great ways to do so depending on how that toe presents and how big that subungual exostosis is. Now, conservative podiatry, particularly when there's a thick dystrophic nail, could be as simple as just reducing the nail thickness. And that's going to allow that patient to be a little bit more comfortable in their footwear. Now, when we're talking about footwear, it's about making sure that we have that really deep and wide toe box so that there's less pressure on the toe, less likelihood of the pain being precipitated when we're walking. And similar to that again is lacing. And I really like the loop lock lacing technique for this because it's going to stop the foot from falling forward in the shoe, causing more of that trauma onto the area where the subungual exostosis may be, but it's also going to stop those shear forces or twisting moments that could be causing even more pain. For some patients, we want to really drop that big toe down or increase their mechanics to stop that big toe from sort of hitting up a little bit more. And a good way to do this is through orthoses. And so, considering whether that might be an appropriate option for your patients is always a good start there. Now, when there's just an isolated increase in pain, maybe the patient's gone on a hike or is about to go on a hike or a longer duration on their feet, that's where photobiomodulation therapy can really help to reduce the edema or the swelling, increase the healing rate, and decrease the pain associated. And this is something that we put in place quite commonly to really good effect for a number of different conditions. But for patients that are just finding very isolated pain, then maybe a pharmacological approach is appropriate, whether that's paracetamol or our non-steroidal anti-inflammatory drugs. There's definitely some options that we've got there which help to reduce the pain that patients are experiencing. But today, hopefully that's given you some non-surgical or conservative treatment options for subungual exostosis. If you liked what you've seen here, please hit the subscribe button, check out some of our other videos, and I'll see you in that session. Cheers.